Hello students, I'm the OGGuru Dr. Punit Bhojani here, the single point agenda to make OBGY your most favorite subject and most scoring subject. Here I am to discuss about the 5 most important things or changes which you need to start doing right away for the upcoming July FMG examination, June-July FMG examination. So please carefully listen to the whole video. It's very important tips, and all of you can also get in touch with me on phone and WhatsApp me on this number for your timetable and guidance. Do download the OGGuru app on Android and iOS. For iOS, the ORG code is YYMSTV. And feel free to WhatsApp me on this number for your personalized timetable and guidance. Now, very important points. Point number 1, covering only the FMGE PYQs is not enough. I'm not here to scare you, but the FMG exam is becoming tougher and tougher. So we need to not only do the FMGE PYQs, of course, but even the NEET PG PYQs also compulsory. You are going to do at least of the last 5 years. No need to do MCQs of 2010, 11, 12, 13, 14, at least 2020 onwards or 2019 onwards. Last 5 to 6 years or last 5 to 7 years preferably, we should definitely do the NEET PG, and time permitting even INI CET also. Please understand this, NEET PG, INI CET, almost the level is same, and I'm not scaring you. FMG exam is becoming difficult by the day. Certain questions have been asked in FMG exam which have never been asked even in NEET PG. Okay, so please don't make the mistake of only focusing on FMG PYQs. Student feels, sir, FMG PYQs are all over, but the grand test score is not increasing. We are not able to pass the exam. So this is important, that we will do the NEET PG as well as INI CET PYQs of 5 to 7 years. Okay, moving on. Next point, whenever clinical case comes, please try to analyze it and like a real doctor. Okay, what do I mean is that preferably, of course it's slightly tough when you begin with, but even without, once you start reading a clinical case history, there's a long question going to be given to you of 4-5 lines. Start picking up the important points as if you are the consultant doctor. Patient has come with what complaints, look at the report and try to arrive at a diagnosis initially, even without looking at the option. Of course, you will then look at the option and then select the most suitable thing. And whenever there are long questions, please remember to read the whole last line, because sometimes the question has become so easy, they're giving a lot of extra information. So that is also important, that sometimes a lot of extra information is given to confuse you. So make sure that you should be very thorough, and that is here comes the concept of concepts, because nowadays, please understand, mug up is becoming very less, ratta maro is becoming very less. Your concept should be strong, and that is what we focus on in OGGuru app. Hashtag crystal clear concepts. If your concepts are strong, any MCQ in the world you can answer. So please, my dear student, it's a time of concept based exam. Get your concepts clear, and then you will be able to answer even the clinical cases with ease. Once you understand the topic, another way is you can also teach your friends, teach your colleagues. Once you do a very tough clinical case, try to explain it to your friends and colleagues in your free time, so that you become stronger with the concept. Because if you can explain somebody the topic well, that means you have understood. Only when you have understood the concept well, you can explain it to someone else. Next very important point which I would like to recommend is, please, time is of utmost important. No wasting time. Daily social media for motivation, you are wasting your time. Please understand this. If your only one question you answer right now, if only one question you answer right now, do you want to clear FMG examination? If your answer is yes, you don't need any other motivation. So please stop wasting that time in seeing all daily motivation videos. Instead of that, you can spend that time on meditation, relaxing and revising. Okay, so if your, as I said, if your answer to the question that do you want to clear FMG in this June-July exam, if your answer is yes, then please from today onwards stop seeing all motivation videos. Yes, you use social media for your advantage to solve your flashcards, solve your challenges, test, all that you please do on social media. Don't waste time in daily motivation. This much motivation is enough. Yes, you have to clear the FMG examination. Ye baar karna hai. So this is clear. So time is of utmost essence. And yes, my dear student, you will have to put in more hours right now. Exam mostly will be in July. Okay, so we have got around 4 months time. Right now you should already be studying at 10 hours every day. 10 hours every day, and within the next 1 month, last 3 months, you need to pick up the pace and put in 12 hours. It is easily possible, even after taking rest and relaxation. Even if you take 7 to 8 hours of rest and then do relaxation for few hours, it is easily possible to put in 10 to 12 hours. So time waste बिल्कुल नहीं करना है. Time is the most important key. There is no substitute for hard work. Please don't look for any shortcut. Okay, so concepts clear रखना है. And very, very important, please take advantage of this OGGuru app. I am here to make OBGY your most scoring subject, most favorite subject is my guarantee. Okay, every year 30 to 35 MCQs are coming in OBGY, minimum 30. 3 years back 42 questions came and all my students got 39, 40, 41, 42 correct. Everybody's score was about 180, 200. And I can assure you that if with your current knowledge, you are getting 10, 11, 12 MCQs correct in OBGY, after you finish my video lectures, you will get 28, 29, 30 MCQs correct in OBGY. So minimum 15 marks, you can see, minimum 15 to 16 marks more you are going to get in OBGY is my guarantee. And 15 marks more, my dear students, I don't need to tell you, is the difference between score of 135 and 150 and 140 and 155. So many students get stuck up at the score of 135, 140 for 2 to 3, 3, 4 attempts. Then they take my app and then they call me and message me, thank you, sir. It's mainly because of OBGY. I've cleared the 150 mark barrier. Of course, all subjects are important. I'm also going to tell you which subject to focus on right now, which subjects to leave in option, and which subjects to do towards the end. But here is your chance that when you study from me through OBGY through the OGGuru app, get in touch with me on phone and WhatsApp. This is minimum 15 to 16 marks more you're going to get in OBGY. Every student has told me, okay, sir, among all 19 subjects, we are best prepared in OBGY because of your app. And when you walk out of the FMGE examination, you will tell me that, sir, among all 19 subjects, my best performance is in OBGY. And how much time do you require, my dear students? Master class OBGY. It has got everything: theory lectures, rapid revision MCQ, PYQs, all clinical case-based scenario, PYQs of both, not only FMG, PYQs of NEET, PG, INI, CT, also beautiful handwritten notes I'm going to show you. And everybody, don't get hassled by 65. Everybody sees the video at 1.5x speed easily. So totally, my dear student, only 42 hours required. Everybody has told me, sir, the way you teach us OBGY, no one else is teaching us. And the speciality, my dear student, is that once you listen to my lectures, you'll remember things for a long, long time. Beautiful handwritten notes, you can revise just in 2 hours. So when a subject, this much effort, yes, you will have to put in. When a subject is going to give you 30 to 35 marks, let me not even say 35, let me just say 30 questions. If you're going to get 42 hours time, you will have to spend, and you will spend, and you should spend. So just 42 hours in OBGY, and of course, everything will be under my timetable and guidance, and OBGY will become your most scoring subject is my guarantee. It will have theory concepts, rapid revision MCQ, mock test, and of course, the beautiful handwritten notes I'm going to show you in some time, and of course, my doubt solving and mentoring. And this is available. Launch 30 is the discount coupon. Absolutely throwaway price. The 3 months package. So the date is not yet announced. You can just take the 6 months package only in 1759 rupees. That is 1750. That's absolutely for complete OBGY with the handwritten notes in app. If you feel you want to take 3 months package, yes, even 3 months package you can take in 1409 only. So choice is up to you. Exam is not yet announced. Actually, it will be in July. So we are in March to April, May, June, July. So 6 months package is good enough, and you can just take this at 1750. 3 months package at 140, and also choices up to you. Now, very important, which 10 subjects you will focus on first. Okay, please understand this. Anatomy, physiology, biochemistry, very, very volatile. Don't do this as of now. Abhi nahi karna hai. Of course, you will do it, but towards the end, matlab you will do this in the month of May and June. Okay, May and June, because before the exam, or May, June and July is when you do these subjects. Okay, and so these 3 subjects you will do later on, and The short 4 subject, please leave right now. Which are the short 4 subjects? Your short 4 subjects, leave. I am telling you, why leave right now? Leave as of now. And you will do it only if time permits. Why? Because these are going to give you just two questions. Hardly two MCQs are going to come in these 4 subjects. These are your derma, ortho, psychiatry and anesthesia. Okay, these subjects are going to give you at the most 2 MCQs or 3 MCQs. Even if 4 MCQ come, these 4 subjects are not more than 12 to 12, ये भी बहुत हो गया, 12 to 15 MCQs only. Okay, so yes, so don't waste too much time on these 4 subjects, and these 3 subjects are last. And the biggest elephant in the room, medicine you are not going to touch right now. Why? I will tell you. So which are the 10 subjects which I should focus on? Please pay attention. You should focus on your pathology, microbiology, pathomicropharmac first, pathomicropharmac, and of course your PSM, and the most important, as I told you, an extremely scoring OBGY. Medicine surgery is difficult to score, but OBGY is very scoring. You can easily get 28, 29, 30 on OBGY. With my guidance is my guarantee. Okay, so first we will focus on patho, micro, pharma, PSM, OBGY. Then very scoring and easy subjects like forensic medicine, ENT, and ophthalmology and radiology. So these, if you see, my dear, so 1, 2, 3, 4, 5, 6, 7, 8, 9, and the 10th subject is your surgery. So this is what you should focus on in the first set of your reading. Okay. So make this 10 subjects your strong. Based on this 10 subjects also, very high chance you can clear the FMGE examination. Okay. So these 10 subjects you will focus on first, and only when medicine, please my dear student, many students start directly and are struggling to finish. Please understand this, that only when, because if your pathomicropharmac and your radiology is over, if your pathomicropharmac and radiology is over, already my dear students 70% medicine is done, isn't it? So pathomicropharma, radiology finish करने के बाद ही आपको medicine start करना चाहिए. Okay, and these 10 subjects you want to focus on. If you want to make it 11 subject, PEDS is the 11th subject. Okay, my dear student. So these 3 subjects of first MBBS, of course they are important. You get around 15 to 20 MCQs. I'm not saying that we are not going to do it. We are going to keep it for later. Why later? Because they are volatile. Finally it is mug up. If you study now, very high chance by July exam you will forget it. So let us do these subjects in the month of June and July only. ये 3 subjects बाद में करना है. Medicine again only in the month of June after all these are over. So right now, which subjects you need to focus on is pathomicropharma, very important for your basics, PSM, very important, OBGY, of course, the most important and very scoring, and easy subjects, forensic, ENT, ophthalmology, radiology. Make the best of this and very quickly go through this. And then surgery, pediatrics. And only when all this is over, you can think of these short 4 subjects, which many students, if you're not getting time, please leave it. That's the chance of course you take, because थोड़ा तो risk लेना पड़ेगा. Risk तो सब लेते हैं, Spider-Man को भी risk लेना पड़ता है. So इतना risk हम as a chance we will have to take further, because the time is very less, is hardly 3 to 4 months time. And the next important point what I want to tell you is, my dear student, grand test analysis is very important. Grand test gives you time management also. Whether are you able to finish the paper on time, section wise are able to finish the paper on time. So time management, so definitely you should give at least 10 grand tests. Try to give 10 grand tests overall. One test you give every 10-15 days. So by the time of April, May, June, July, around 10 tests you should give. No need to give too much. Okay, don't give 15-20 grand tests, 10 grand tests diya, proper is good enough. Grand test se time management, and grand test tells you about your mistakes. Grand test mistakes analysis is of utmost importance. and grand test tells you which are your weak subjects, and not only weak subjects, specifically which weak subtopics. Okay, so not only subject कौन सा आपका weak है, but वो subject के अंदर कौन सा आपका सब टॉपिक और टॉपिक विच इज वीक also you get to know with the grand test analysis. Okay, and very important, my dear student, when the MCQ goes wrong, please understand, just don't give the grand test, sir, 3 hours paper done. No, analyze the whole day, analysis of the paper and reviewing all the MCQs and spending the whole day. You need to give whole day time to grand test, because when your MCQ is wrong, you have to find out why did it go wrong. Was it a silly mistake? Okay, sir, I know the question, I knew the question, I know the answer, but I made a silly mistake because I didn't read the question correctly. एक्सेप्ट पूछा था, एक्सेप्ट नहीं पढ़ा, नॉट नहीं पढ़ा, ये सब करके सिली मिस्टेक हो गया. ओके ओके, but at least I know the concept, this is fine. But really, sir, I got the question wrong because I did not know. This is danger, my students. Okay, sir, my dear students, this I got it wrong because I did not know only this topic. Okay, so please, if you did not know the topic, and constantly in that topic only, if your question is wrong, then that subject and that topic you need to go into depth and get more detailed videos and more explanation you need to do of that topic and video. Is it clear? So if it's a silly mistake, that's okay. Make sure you don't repeat it, then you don't repeat the mistake. Okay, don't repeat. But if the topic itself you did not know, then you need to focus on these topics and make it your strong. So grand test analysis is of utmost importance. So my dear student, all these are important tips: getting hang of concept based questions, clinical case scenario, time management, do not wasting time on social media, make OBGY your scoring subject. That is helping many students to cross from 130 to 155 overall. And just have a look at all these beautiful handwritten notes, crystal clear, completely integrated notes, colored notes, diagram, everything is there in the app. These notes are available for in-app viewing free of cost along with the master class examination. So these are some of the very important points. You can just read all the students' testimonial and review. And everybody said that, sir, among all 19 subjects, sir, everything OBGY was best. Among all the best part was OBGY, sir, best paper, all subjects were OBGY was the easiest to solve. So because of your lecture, we could solve the OBGY overall with utmost ease. Okay, my dear students. So here's wishing you all the best for your upcoming examination. Do follow me on your Insta, YouTube, and also Telegram. And I will, of course, once the exact date is announced, we will be coming up with a detailed timetable, day-wise strategy once we know the exact date. Right now, you assume that it is a June exam. Exam will be mostly in July. So we have got 3 to 4 months time. That's it. 3 to 4 months time are there. And yes, it is possible. It is possible to crack the FMGE examination in this 3 to 4 months time if you follow this. And the last point which I want to tell you is absolutely positive thinking only. The power of positive thinking, very important. Every day, 5 minutes or 3 to 5 minutes before you go to sleep, imagination. Be extremely focused and positive, and power of positive thinking, imagination. Because only if you can imagine it, you will be able to achieve it. What I want you to imagine is that you are going to the examination hall. Inside the exam, imagine yourself. That's why I'm solving all the MCQs in the exam and all my questions are going correct. Imagine yourself, you're coming out of the examination hall and jumping with joy. Sir, paper 1 over, super. Paper 2 going, all correct, superb ho raha hai. Coming out, jumping in joy. Imagine yourself on the day of the result, jumping in joy when you have crossed 170, 180, 200, 225. Keep on visualizing yourself and imagine yourself that you have already started your preparation for NEET PG and now you are getting your dream branch of your choice and you already become a consultant also. Okay, so every day you will spend 3 to 5 minutes just on this positive thinking, and you will imagine all good things are going to happen to you, and imagine yourself in that situation. This is extremely important. So stay focused, stay extremely put in a lot of hard work, and definitely get in touch with me on phone and WhatsApp on this number. I'm there to help you out and make OBGY your most scoring subject and most favorite subject. Wishing you all the best for the upcoming examination, and see you soon.